Why you lose a few bones. It's abnormal to contemplate. You can't help thinking about how this might actually occur, since they're covered by your skin. You're brought into the world with around 300, yet end up with only 206. A huge number, similar to those in your skull, combine as you develop. What compels you develop? However long development plates, toward the finish of long bones in your arms and legs, remain open, you develop. The plates close in the late teenagers for young men, and in no less than 2 years of beginning periods for young ladies. The most effective method to keep your bones sound. Your bones gain in thickness until you turn 30. Then thickness declines except if you get sufficient activity, calcium, vitamin A, vitamin K and vitamin D from the food sources you eat. What makes solid bones their best is furnishing them with the supplements they need and getting exercise, even day-to-day strolls. How broken bones recuperate. The cycle can vary in light of what sort of break happened. Most breaks are healable, and veins structure in the space very quickly after you break it to assist the mending system with starting. In no less than 21 days, collagen structures to solidify and hold the wrecked pieces set up. The harmed surfaces sew together to frame new bone, and frequently the new bone is more grounded than the first one. Your skeleton has many positions. It moves you. It safeguards your mind, heart and lungs. It fabricates platelets. What's more, it stores and controls minerals to assist your whole framework with working. Your longest and most brief bones. Your femur, or thigh bone, is longest. The stirrup-form stapes in your center ear, estimating just 0.11 inches, is most limited. Where you have the most bones. The 54 bones in your grasp, fingers and wrists permit you to compose, utilize a cell phone and play piano. Bone is living tissue. Collagen in bone continually renews itself, so about at regular intervals, you have another skeleton. Your teeth are essential for your skeleton as well. They contain calcium and minerals like bones. Yet, they need collagen, which gives bones adaptability and strength. The extraordinary occupation of a lady's skeleton. People's skeletons look shockingly indistinguishable. Yet, the shape, size and point of a lady's pelvis are exceptionally intended for labor. A few joints don't move. Your bones meet up at the joints. Some, like your knee joint, move a great deal. Others, like the joints in your noggin, don't move by any means. For what reason do joints squeak? Muscles and tendons support your joints, and ligament assists with patting them. At the point when ligament breaks down, joint pain happens. What's an interesting bone, at any rate? It's not so much as a bone. It's your ulnar nerve, which runs inside your elbow. Hitting it sets off a shockingly shivering, thorny torment. Your bones and your skeleton are genuinely astonishing, Dr. Stern says. How they develop, fix themselves and keep your whole body situated as you travel through your life, works everything out such that vital that you give your all to keep them solid. Ensuring you eat well and exercise as frequently as you can will assist with guaranteeing they support you, as long as you really want them to, she says. Skull, which contains the jawbone. Cervical, thoracic, and lumbar vertebrae, sacrum, and tailbone, coccyx, in the spine. The sternum and ribs of the chest. Scapula, shoulder blade, clavicle, collarbone, humerus, upper arm bone, radius, and ulna. Hands, phalanges, metacarpals, and wrist bones, carpals. Hip bones in the pelvis. Legs, femur, thigh bone, patella, kneecap, tibia, shin bone, and fibula. Tarsals, metatarsals, and phalanges on the feet. The long bone is long and thin in shape. The bones in the arms and legs, apart from the wrists, ankles, and kneecaps, are 2 examples. Long bones function as levers to allow movement with the assistance of muscles. Short bone with a cube squat form. The bones that make up the wrists and ankles. A flat bone has a broad, flat surface. Ribs, shoulder blades, the breastbone, and skull bones. An irregular bone is one whose shape does not fit any of the aforementioned 3 categories. Vertebrae, which make up the spine. The periosteum is a thick, strong outer layer that protects nerves and blood vessels. The tough, smooth covering that shields the internal tissue is called compact or thick tissue. Most bones contain a porous honeycomb substance called spongy or cancellous tissue, which permits the bone to be both strong and light. Bone marrow is the jelly-like substance that creates blood cells and is located inside the cavities of various bones, especially the pelvic. By adding and removing bone tissue as needed, our body constantly remodels its skeleton. Each bone must therefore be completely regenerated once every 10 years. Bone cells that participate in this process include The cells that form bone tissue are called osteoblasts. Osteocytes, which regulate the mineral and calcium content of bone tissue, help to sustain bone tissue. The cells that decompose aging bone tissue are called osteoclasts. The health and strength of bones are influenced by a variety of variables. Bone density is dependent on a consistent intake of dietary calcium, adequate vitamin D intake from food and sunlight, a nutritious diet rich in vitamins and minerals, hormones such as testosterone, estrogen, calcitonin, growth hormone, and parathyroid hormone, regular lifting of weights. The strongest bone in the human body is the femur, which is also the longest and thickest bone in the body. The femur is located in the thigh region and is a critical part of the body's ability to stand and move. It can support as much as 30 times the weight of the body. The femur is made up of several parts, including the head, neck, greater trochanter, lesser trochanter, intertrochanteric line and crest, and shaft. The proximal end of the femur connects to the hip joint, while the distal end flares out in a cone shape onto a cuboidal base of the medial and lateral condyle, which join the femur to the tibia, forming the knee joint. When a bone is fractured, the body immediately begins the process of repairing the damage. Here are the steps involved in bone repair after a fracture. Hematoma formation. Within a few hours of the injury, a blood clot forms around the fracture to protect the area and prevent further damage. The area around the fracture becomes inflamed, which signals the body to stop using the injured part so it can heal. Granulation tissue formation. About a week after the injury, soft tissue called granulation tissue replaces the blood clot. The callus holds the bone together, but it isn't strong enough for the body part to be used. Bony callus formation. About 2 weeks after the injury, cells called osteoblasts move in and get to work. They form new bone, adding minerals to the mix to make the bone hard and strong as it bridges the broken pieces. This stage is called the hard callus. It usually ends 6 to 12 weeks after the break. Bone remodeling. Once the bone is healed, it undergoes a process of remodeling, where cells called osteoclasts break down any extra bone that formed during healing, so your bones get back to their regular shape. This step may continue long after you feel better, sometimes lasting up to 9 years. Factors that can affect bone healing include the severity of the break, damage to the muscles, skin, and nerves in the area of the broken bone, vitamin deficiency, and medical conditions such as osteoporosis and osteogenesis imperfecta. To promote faster healing, it's important to ensure proper alignment of the broken bone fragments, stability and support of the fracture site through immobilization, and a healthy diet that provides the nutrients, vitamins, and minerals needed for bone healing. Nutrition plays a crucial role in bone healing after a fracture. Here are some ways that nutrition can affect bone healing. Calcium. Calcium is an essential nutrient for bone health and is a building block for bones. It is important to consume enough calcium to help heal a broken bone and/or decrease the risk of future fractures. Good sources of calcium include milk, yogurt, cheese, broccoli, turnip or collard greens, kale, bok choy, soy, beans, canned tuna or salmon with bones, almond milk, and fortified cereals or juice. Adults should get between 1,000 and 1,200 milligrams of calcium each day. Vitamin D. Vitamin D is important for bone health because it helps the body absorb calcium and make bone cells. Exposure to sunshine helps the body make vitamin D, which can also be obtained from food and supplements. Living in areas with limited sunshine or long winters can increase the risk of vitamin D deficiency, which is associated with several health concerns, including impaired bone health. Your doctor may recommend up to 5,000 U vitamin D3 daily during periods of bone healing. Protein. Protein is a key nutrient for bone healing because it helps the body build new bone for the repair. It also helps the body take in and use calcium, another key nutrient for healthy bones. Good sources of protein include meat, fish, milk, cheese, cottage cheese, yogurt, nuts, seeds, beans, soy products, and fortified cereals. Vitamin C. Vitamin C helps the body make collagen, which is an important building block for bone. Collagen helps the bone fracture heal. Good sources of vitamin C include citrus fruits like oranges, kiwi fruit, strawberries, and bell peppers. Other nutrients contained in fruits and vegetables such as potassium, magnesium, iron, and zinc have been associated with increased bone density in some studies. Thank you for watching. Please like and subscribe for more facts videos.